More controversial takes on autism from Health and Human Services Secretary Robert F. Kennedy Jr. Just a few days after calling the disorder an epidemic, RFK says he wants a national autism registry. Iowa's News Now anchor Lauren Evanetti is live in studio tonight getting a reaction to that.
Mitch, Health and Human Services Secretary Robert F. Kennedy Jr. spearheading a controversial initiative to create a national autism registry to study and track all Americans with autism. Autism advocacy group says it's a big red flag for privacy since there's no choice to opt in or out of that list.
It sounds like it might breach HIPAA because you always have to give consent, right, when you're providing your health information. That is problematic. All registries that I'm aware of are opt-in. I think, consent is absolutely key to all those things.
RFK Jr.'s plan involves obtaining private medical data from various sources, including pharmacy chains, lab tests, smartwatches, and insurance claims. The National Institutes of Health says it'll provide that data, pulling from multiple federal and commercial databases to study the neurodevelopmental disorder, using comprehensive patient data with broad coverage of the U.S. population for the first time. But advocates say the plan sidesteps privacy laws and undermines people's rights.
You're kind of undermining the dignity and rights of individuals with autism. These are people with rights, and we can't just toss that away.
Many parents and people with autism say the move to track them and their children in a national registry without permission crosses a line into surveillance, not support. And they don't want their personal medical information being used without consent either.
It doesn't sound like, from his perspective, we're really valuing the lives of those individuals. And I would hate to see it resort to something like that.
Now, there's growing fear in the community that the plan and the language surrounding it echoes the eugenics-era policies of the past, where science was used as a tool for segregation.
I think this community needs all the support it can get. I just want to make sure it is done with good intentions and is really aimed at improving the lives of individuals that are impacted by this.
While it's still early in the rollout, advocates say transparency, consent, and legal compliance must be at the forefront of any future plan. There is a petition on change.org. We'll have the link to that on this story on iowasnewsnow.com. Live in studio, Lauren Evanetti, Iowa's News Now.